I'd like to welcome to stage Sam Everington, who is going to do a quick presentation about his work, and then I'll get the rest of you up in a moment. Thanks, Sam.
All right. So I'm a GP at the Bromley by Bow Centre. 20% of health is covered traditionally by the health service. The 80% is not traditionally covered. But what I'm going to show you is what we're doing at the Bromley by Bow Centre, which we started about 35 years ago. I'm also hopefully going to show you the concept of happy staff, happy patients. So do both at the same time and you get a win-win for everybody. So here we are in Tower Hamlets, a massively diverse population, 60 different ethnic minority groups. And this is a typical scene at Bromley by Bow. When I was at BMA House 12 years ago, as one of the leaders of the BMA, I had to deal with the bus bomb. And when I came back that evening, I realised how important human relationships was. If you don't know somebody, you hate them. If you hate them, that's when you bomb them. So how do you bring communities together? But let me ask you the question, how often would you see this picture in your community? How important it is, therefore, actually, when you're making people feel better, to bring different communities together. The alternative, of course, is this. In our community, 5 chicken shops in a row. There's 42 chicken shops per secondary school in Tower Hamlets. And I jest not when I tell you that I recommend McDonald's to my patients. That's the healthy end of the market. But you get a sense, actually, of what the alternative actually is for a lot of people in their lives. Of course, this was the Bromley by Bow Centre originally. I'm an East Ender. My patients they knew this as dog shit green. You will know those spaces around London, scary spaces which people dare not go into. This is what it looks like today. Creativity is a major pillar of that 80% that I talked about, creativity and people's spirituality. These, by the way, are just a couple of things that have been made at the centre. Look at the path there, curved. Now, most parks, they would go from A to B, wouldn't they? But no, this is curved. It's actually a river, and if you saw this river, you would see lots of bit of pottery on the bottom, and pottery of snails, frogs, leaves, things you'd see at the bottom of a river. Of course, if you meander through a park, guess what? You see a lot more. If you just walk straight, you miss everything. And of course, it's a beautiful space. First thing we did on the park was build on it. That's quite an anathema. And of course, this is the entrance. No NHS sign, by the way. This was something that came from the Strand in the 30s. We persuaded Tesco's to pay to put it up. It's a beautiful space. And of course, you come into our courtyard, you've got the wisteria. Smell is really important. Just imagine the awful smells in hospital. You're not even allowed flowers in hospital now, are you, anymore? The smell, relaxing people down. So there's a fish pond. Look, when patients come and see their doctor, it doesn't matter what doctors think. Actually, I presume they've got meningitis or they've got cancer. They are scared. And so anything you can do to relax them down, absolutely vital. Now, one of the things we also do in the centre is share our space. This started life as the flower arranging and leg ulcer clinic. It's the sort of interesting things we do. They're now, because we've got rid of the leg ulcers, they're now called the Young at Art group. And as you can imagine, they're doing amazing things. Come into the waiting room area, no barriers, no screens, no windows, no CCTV cameras. Actually, it's an art gallery for all the artists in the centre. Come into my consulting room, which I share with everybody else. Note the difference. Note the importance of design, how that changes relationships. You're sitting next to a patient. There's flowers on the desk. There's pictures of my family there. Now, I need to be kept well too. And of course, all the regulations will say to you, well, you've got to have frosted glass because of confidentiality. Well, I thought, I don't want to be working in a toilet. So I went to my lead glass artist, Sheena, and I did my ECG, and we've turned it into stained glass. So what happens also is if you put a whole raft of different people together, you get the most amazing creativity that come out of it. It's completely unpredictable, but boy, is it fun. And we often define what we do. You'll get, if you ever get an email from me, you'll see it says, not I'm a fantastic outcome in general practice, saving lives, anything like that. It is basically fun, friendship, compassion, and assume it's possible. And that's what this centre's all about. This is some of Sheena's other art that you can see throughout the centre. And of course, our community care group works hand in hand with the Potter. And by the way, that one on the lovely yellow one there is done by the Potter, who I first knew as the local policeman. And he fell in love with the Potter there, gave up being a policeman, and now he's a Potter in himself. And of course, what's absolutely fascinating is the times you walk in and there's lots of young lads coming to talk to him about hypothetical situations. This is about really engaging with the community. And of course, anything for a party at Bromley by Bow. Why would you not have an egg and spoon race? But actually, why would you not do it with the chief exec of Barclays Bank? And I won't tell you which one. Paralympics, okay. Of course, that stone sculpturist who did that green one there also did this one here. Absolutely fantastic. This was imagine that grey picture. Okay, she had this kanga hammer, you know, the things that you have on the streets, and created this most amazing piece of art. And that was artistic in itself because you could see people drawn to this noise. And the message was something new is happening in town. Of course, educational classes, English second language, jobs advisors in the park. That's one of our artists, the director of art behind there, his art on the wall, but apprentices involved in art. More of their art. Grannies in the Kitchen project, all about creating. And of course, gardening and health. So I'm part of the National Gardening Scheme, amazing organisation that collects money for Macmillan. And we did a report with the King's Fund not so long ago talking about gardening and health. Gardening is probably one of the most important things that you can persuade any patient to do. It's creative, it creates well-being. In fact, all the people who come to those gardens opened around the country, do you know what's number one on their list? Is it about the flower ranges or the trees or anything like that? No, it's mental health and well-being. And of course, we have allotment gardens. We train people in gardening. And of course, there's always a love story, hopefully, behind everything we do, because this was a couple who met on the gardening project and are now our item. And this is Fatima, our advocate, so she's employed as part of our health team. And this is her project, a combination of grannies in the kitchen and now a walking group that do amazing stuff. Volunteers. And of course, if you come to the centre, this is the front end we call our Connect Zone. So now I've put it as chair of the CCG, I've put social prescribing in every practice in our Hamlets. It is now as normal to get ibuprofen, referral to a specialist, social prescribing in every practice. And how good is that when you think that anyway, 1 in 7 procedures in the NHS has no evidence for it? And actually, we do a lot of dangerous stuff as doctors. 5% of the elderly admitted are admitted because of side effects from drugs. Drugs have their place, and we have some of the best outcomes in diabetes and heart disease, but so does all this other stuff. What's more important if you've had a heart attack? Is it the drugs or the rehabilitation and exercise? Rehabilitation exercise. What happens to an 80-year-old in bed in hospital for 10 days? 10% loss of their muscle strength, equivalent of 10 years inactivity. Okay? If you are inactive in life, that's 10 years loss of life. It's quite extraordinary. It's a very strong message, isn't it, about the social determinants of health and, most importantly, the creative side of people's lives. So we have an internet cafe here, but the social prescribers hang out here. You come in there and you say, well, how can I help you today? Is it your housing problem? Is it a job you need? Do you want me just to show you how to use the laptop? Great sense of openness and sense of ownership by the community of our centre. And of course, we are a community university, so why wouldn't you celebrate with a degree, typical degree celebration? Of course, this all started as the church. And this is my wedding 5 years ago. This is the vicar, who's also in the House of Lords. He and I have one thing in common, champagne. We don't have religion in common. He's religious, I'm not. But that doesn't stop us. And actually, he will say that his congregation is the 4,000 people who come through here every week. And this is just part of our team collecting money for charity. A patient actually who had cancer at the age of 50 joined one of our art groups because she lost her job. She had a vocal cancer, she couldn't talk. Didn't like the art. but joined the IT group and got IT skills and is now back in employment. This is spreading out across the country. This isn't just 35 years ago. We were Guardian reading Sandal Brigade nut jobs. Now we are part of the establishment, actually. It's what's spreading like wildfire across the country. This is one of our other surgeries with the Princess's Trust. This is one of our other surgeries where we're doing things like, this is the Exmosaurus project. So actually the kids create dinosaurs, and then this is kids with eczema, and then come in and they wash their dinosaurs in oil and steroid cream or whatever. And of course they become expert patients. This is another project, actually reduced admission to hospital from 11 to 8 days, just by, so I'm a yachty too, and if you're a yachty, there's a bag that you grab. It's called the grab bag when you're about to sink. And it's the same sort of concept, but we hope it doesn't help, it stops people from sinking. A place for your dentures, your glasses, everything about you, so that actually the moment you go into hospital, everything's prepared to get you out. Hospitals are dangerous places if you're frail. This is a mental health trust that reduced acute admissions by 1/3 by opening up a cafe 7 days a week, a bit like ours. 7 days a week, staffed by health workers that you could just go and talk. Isn't that incredible? And that's what actually I think you've shown throughout this afternoon. You have treatments that way surpass all the traditional treatments that I was taught at medical school and that we do in the NHS. And of course, owl therapy. Now, autism, really tough to manage, One of the most difficult jobs I've got as a GP. But this particular therapy is absolutely amazing. I can't tell you why it works, but an owl flying around with a kid with autism, something magic happens, a bit like the magic we saw early on. And of course, this is a project, an amazing project. So 47% of people with terminal illness die in hospital. You don't want to die in hospital. Given the choice of dying at home surrounded by your loved ones, that's what you would want. They've reduced it to 14%, so they've cut it by 1/3, because you can get hold of nurses 24 hours a day when you need their help, not when the professionals think that's appropriate. And the equivalent I do is I give my mobile phone to all my complex care patients, my cancer patients, my housebound patients. They can ring me anytime, even when I'm not on duty or on holiday. It massively improves their care. It massively, interestingly, reduces my work. That's the fascinating thing. And it massively reduces bereavement at the end of the day. We were talking earlier on about this, actually. If you can help a family manage the terminal illness of their loved ones at home, you will massively reduce their bereavement. So I just sent a text to one of my patients yesterday. I shared it with you earlier on, who actually had ended up by dying in hospital. But because of all that communication, do you know what I mean? It was the best death that could have been in the circumstances. And of course, anything for a party at Bromley by Bow, as I said before, and this is one of our patients who's an opera singer in the park. That's Bromley by Bow. It's about creativity, it's social prescribing, it's recognising that social side of people's life is just and sometimes more important. Actually, it's about what matters to people rather than what I was taught to work out what the matter is with people. You're not a cancer patient, you're not a diabetic, you are a person. And until we move in the direction, actually, of surrounding people with what they now call personalised care or social prescribing, we won't be delivering what we need to deliver in healthcare.